Hi, I'm Mark Johnson, your educator at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. This innovative AI-powered question bank adjusts to your performance and provides audio rationales for a unique and efficient review process. For full access, please refer to the description box below. Have your notebook ready and follow along as we sharpen your critical thinking skills. Let's get started with question 1.
A 32-year-old client with HELP syndrome is admitted to the maternity ward. She is 34 weeks pregnant and has just been informed that an emergency cesarean section is necessary. The client appears anxious and tearful, repeatedly asking if her baby will be okay. What is the nurse's priority psychosocial intervention? Acknowledge her feelings and provide reassurance about the medical team's expertise. Explain the surgical procedure in detail to alleviate her anxiety. Encourage her to focus on the positive outcomes of the surgery. Offer to contact a family member to provide additional support. The correct answer is A. Rationale. Correct answer, the first option. Acknowledging the client's feelings and providing reassurance about the medical team's expertise is crucial in this scenario. It addresses her immediate emotional needs and helps build trust, which is essential for her psychological well-being. This approach validates her concerns and provides comfort, reducing anxiety. In a crisis situation like HELP syndrome, where the client faces both physical and emotional stress, empathetic communication is a priority. Distractor rationales. B. The second option. While explaining the procedure can be helpful, it may overwhelm the client with information and increase anxiety if not done sensitively. C. The third option. Encouraging focus on positive outcomes may dismiss her current fears and is not the most empathetic response. D. The fourth option. Contacting a family member can be supportive, but the immediate priority is to address the client's emotional state directly. Clinical tip. In crisis situations, prioritize empathetic communication to address emotional needs. Validating feelings can significantly reduce anxiety and build trust. A 45-year-old client with a history of rheumatic heart disease is admitted to the hospital for worsening heart failure symptoms. The client expresses feelings of frustration and hopelessness about their chronic condition. The nurse notes that the client has been withdrawn and is not engaging in conversations with staff or family. What is the most appropriate initial nursing intervention to address the client's psychosocial needs? Here are the options. Option 1. Acknowledge the client's feelings and encourage them to express their emotions. Option 2. Refer the client to a mental health specialist for evaluation. Option 3. Provide educational materials about rheumatic heart disease management. Option 4. Encourage the client's family to visit more frequently to provide support. The correct answer is A. Rationale. Correct answer, the first option. Acknowledging the client's feelings and encouraging them to express their emotions is the most appropriate initial intervention. This approach helps build trust and rapport, allowing the client to feel heard and understood. It also provides the nurse with valuable insights into the client's emotional state, which is crucial for developing an effective care plan. Addressing emotional needs is a key component of psychosocial integrity, especially in clients with chronic conditions like rheumatic heart disease. Distractor rationales. B. The second option. While a referral to a mental health specialist may be necessary, it is not the initial step. The nurse should first establish a therapeutic relationship. C. The third option. Providing educational materials is important but does not directly address the client's immediate emotional needs. D. The fourth option. Encouraging family visits can be supportive, but the nurse should first address the client's feelings directly. Clinical tip. Building a therapeutic relationship through active listening and empathy is essential in addressing the psychosocial needs of clients with chronic illnesses. An elderly client is admitted to the hospital with severe hypokalemia, As part of the safe and effective care environment, the nurse understands the importance of implementing safety measures to prevent complications. Which nursing intervention is most appropriate to address the potential safety risks associated with hypokalemia? Here are the options. Option 1. Place the client on continuous cardiac monitoring. Option 2. Encourage increased intake of fluids rich in potassium. Option 3. Apply restraints to prevent falls due to muscle weakness. Option 4. Administer potassium supplements without a physician's order. The correct answer is A. Rationale. Correct answer, the first option. Continuous cardiac monitoring is crucial for a client with severe hypokalemia, as low potassium levels can lead to cardiac arrhythmias, which are potentially life-threatening. This intervention allows for the immediate detection of abnormal heart rhythms, enabling timely intervention. Ensuring cardiac safety is a priority in managing hypokalemia due to its direct impact on cardiac muscle function. The nurse must implement this safety measure to prevent complications effectively. Distractor rationales. B. The second option. While increasing potassium intake is important, it should be done safely and as part of a broader treatment plan that includes monitoring electrolyte levels. C. The third option. Restraints are not an appropriate first-line measure and should only be considered if all other options to ensure safety have been exhausted. D. The fourth option. Administering supplements without a physician's order is unsafe and not within the nurse's scope of practice. Clinical tip. In cases of hypokalemia, always assess the client for muscle weakness and monitor for any heart-related symptoms as they are at increased risk for arrhythmias. A 2-year-old child is admitted to the pediatric unit with a diagnosis of failure to thrive. The child has a history of developmental delays, and the parents express feelings of guilt and anxiety about their child's condition. Which nursing intervention should the nurse prioritize to address the family's psychosocial needs? Here are the options. Option 1. Encourage the parents to attend a support group for families with similar challenges. Option 2. Provide the parents with educational materials about developmental milestones. Option 3. Arrange for a nutritional consult to address the child's dietary needs. Option 4. Schedule a meeting with a child psychologist to assess the child's mental health. The correct answer is A. Rationale. Correct answer, the first option. Encouraging the parents to attend a support group addresses their feelings of guilt and anxiety by providing emotional support and shared experiences with other families facing similar challenges. This intervention helps reduce isolation and promotes coping by connecting them with a community that understands their situation. While educational materials and consultations are important, addressing the parents' psychosocial needs is crucial for their mental well-being and ability to care for their child effectively. Distractor rationales. B. The second option. While educational materials are useful, they do not directly address the parents' emotional needs or provide the support necessary to alleviate their feelings of guilt and anxiety. C. The third option. A nutritional consult focuses on the child's physical health rather than the parents' psychosocial needs, which is the priority in this scenario. D. The fourth option. While a psychological assessment may be beneficial, it does not directly address the parents' immediate psychosocial concerns. Clinical tip. In cases of failure to thrive, addressing the family's emotional and psychological needs can be as important as addressing the child's physical health. While reviewing home care notes, a community nurse visits a 78-year-old client who has been experiencing dizziness upon standing, decreased appetite, and recent falls. The client is currently on antihypertensive medication. What is the most appropriate nursing intervention? Here are the options. Option 1. Encourage the client to increase fluid intake. Option 2. Advise slow position changes from sitting to standing. Option 3. Contact the healthcare provider to review medication. Option 4. Instruct on high-sodium diet to increase blood pressure. Option 5. Recommend bed rest until symptoms resolve. Rationale. Correct answers: the first option, the second option, the third option. The first option. Encouraging fluid intake helps correct potential dehydration-related hypotension. The second option, advising slow position changes, helps prevent orthostatic hypotension and falls. The third option, contacting the healthcare provider to review medications, is crucial to evaluate the need for dosage adjustment or medication change. Distractor rationales, D. The fourth option. This option is incorrect because a high-sodium diet is generally not recommended without physician approval, especially in clients with hypertension. E. This option is incorrect because bed rest is not necessary and can lead to muscle deconditioning and other complications. Clinical tip: monitor for orthostatic hypotension by assessing blood pressure changes from lying to sitting to standing positions. Memory aid: use the 3 Ds of dizziness: dehydration, drugs, and drops in blood pressure. A 10-year-old child with muscular dystrophy is admitted to the hospital following a respiratory infection. The child's parents express feelings of helplessness and anxiety about managing their child's condition at home. What is the nurse's priority intervention to address the family's psychosocial needs during this crisis? Here are the options. Option 1. Provide detailed education on managing respiratory infections at home. Option 2. Arrange a meeting with a social worker to discuss community resources. Option 3. Encourage the parents to join a support group for families with muscular dystrophy. Option 4. Facilitate a family meeting with the healthcare team to discuss care plans. The correct answer is D. Rationale. Correct answer, the fourth option. Facilitating a family meeting with the healthcare team to discuss care plans is the priority intervention. This approach addresses the immediate crisis by providing the family with a clear understanding of the child's condition and care needs, reducing anxiety and feelings of helplessness. It also ensures that the family is actively involved in decision-making and planning, which can empower them. While other options are beneficial, the family meeting directly addresses the crisis by providing comprehensive support and information. Distractor rationales. A. The first option, education on managing infections, is important but does not address the immediate psychosocial crisis. B. The second option, community resources are valuable but may not provide the immediate support needed during a crisis. C. The third option, support groups are helpful for ongoing support but do not address the immediate need for a coordinated care plan. Clinical tip: involving families in care planning and decision-making can significantly reduce anxiety and improve their ability to manage chronic conditions at home. A 30-year-old client with Graves' disease is experiencing anxiety and difficulty coping with their diagnosis. The client reports feeling overwhelmed by the symptoms and treatment regimen. What is the most appropriate nursing action to support the client's coping mechanisms? Here are the options. Option 1. Provide detailed information about the disease and treatment options. Option 2. Encourage the client to join a support group for individuals with thyroid disorders. Option 3. Suggest the client take a break from treatment to reduce stress. Option 4. Focus on medication adherence to stabilize thyroid levels. The correct answer is B. Rationale. Correct answer, the second option. Encouraging the client to join a support group provides an opportunity to share experiences and learn coping strategies from others facing similar challenges. Support groups can reduce feelings of isolation and provide emotional support, which is essential for managing anxiety and stress associated with chronic illnesses like Graves' disease. Distractor rationales. A. The first option. While information is important, it may not directly address the client's emotional needs or enhance coping. C. The third option. Suggesting a break from treatment can be harmful and does not address the client's need for coping support. D. The fourth option. Medication adherence is crucial but does not directly support the client's coping mechanisms. Clinical tip: support groups can be a valuable resource for clients with chronic conditions, offering both emotional support and practical coping strategies. A 35-year-old client with bipolar disorder is admitted to the psychiatric unit during a manic episode. The client is currently prescribed lithium carbonate and has a serum lithium level of 1.6 MEq per liter. The client reports nausea and hand tremors. What is the nurse's priority action? Here are the options. Option 1. Administer the next scheduled dose of lithium. Option 2. Hold the lithium dose and notify the healthcare provider. Option 3. Encourage the client to drink more fluids. Option 4. Monitor the client's vital signs every 4 hours. The correct answer is B. Rationale. Correct answer, the second option. Holding the lithium dose and notifying the healthcare provider is the priority action. The client's serum lithium level is above the therapeutic range, 0.6 to 1.2 milliequivalent per liter, and symptoms of nausea and hand tremors suggest lithium toxicity. Immediate intervention is required to prevent further complications. Distractor rationales. A. The first option. Administering the next dose of lithium could exacerbate toxicity and is unsafe given the current serum level. C. The third option. While maintaining hydration is important, it does not address the immediate concern of potential lithium toxicity. D. The fourth option. Monitoring vital signs is important, but does not directly address the issue of lithium toxicity. Clinical tip: regular monitoring of serum lithium levels is crucial in clients taking lithium to prevent toxicity, especially when symptoms like nausea and tremors appear. A 65-year-old client with a history of chronic kidney disease is admitted to the hospital with hyperkalemia. The client's current potassium level is 6.5 milliequivalents per liter. The nurse notes that the client is on a cardiac monitor showing peak T waves. The healthcare provider has ordered sodium polystyrene sulfonate, Kayexalate, to be administered. What is the nurse's priority action to ensure the client's safety? Here are the options. Option 1. Administer the sodium polystyrene sulfonate immediately. Option 2. Verify the client's bowel function before administering the medication. Option 3. Place the client on a low potassium diet. Option 4. Prepare the client for hemodialysis. The correct answer is B. Rationale. Correct answer, the second option. Verifying the client's bowel function is crucial before administering sodium polystyrene sulfonate because it works by exchanging sodium for potassium in the intestines. If the client has impaired bowel function, there is a risk of bowel necrosis. Ensuring bowel function is intact prevents potential complications and ensures the medication can be safely and effectively administered. This action addresses both safety and infection control by preventing adverse effects. Distractor rationales. A. The first option. Administering the medication immediately without verifying bowel function could lead to serious complications if the client has impaired bowel function. C. The third option. While a low potassium diet is important for managing hyperkalemia, it is not the immediate priority in this acute situation. D. The fourth option. Preparing for hemodialysis may be necessary if the hyperkalemia is life-threatening, but verifying bowel function is a more immediate safety concern before administering the ordered medication. Clinical tip: Always assess bowel function before administering sodium polystyrene sulfonate to prevent complications such as bowel necrosis, especially in clients with renal impairment. A 55-year-old client with rheumatoid arthritis has been experiencing increased joint pain and stiffness, leading to difficulty performing daily activities. The client expresses feelings of frustration and isolation due to their condition. Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1. Encourage participation in a support group for individuals with chronic illnesses. Option 2. Suggest physical therapy to improve joint mobility. Option 3. Discuss medication adjustments with the healthcare provider. Option 4. Provide education on dietary changes to reduce inflammation. The correct answer is A. Rationale. Correct answer, the first option. Encouraging participation in a support group for individuals with chronic illnesses addresses the client's feelings of frustration and isolation by providing social support and a sense of community. This intervention directly targets the psychosocial aspect of the client's condition, offering emotional support and shared experiences with others facing similar challenges. While physical therapy and medication adjustments are important for managing physical symptoms, addressing the client's mental health needs is crucial for overall well-being. Support groups can also empower clients by providing coping strategies and reducing feelings of loneliness. Distractor rationales. B. The second option. While physical therapy can help improve joint mobility, it does not directly address the client's psychosocial needs related to frustration and isolation. C. The third option. Discussing medication adjustments focuses on managing physical symptoms rather than addressing the client's emotional and social concerns. D. The fourth option. Dietary changes may help reduce inflammation, but do not directly impact the client's feelings of isolation and frustration. Clinical tip. Incorporating psychosocial interventions, such as support groups, can significantly enhance the quality of life for clients with chronic conditions by addressing emotional and social needs. A 65-year-old client with a history of polycythemia vera is admitted to the hospital for shortness of breath and headache. His hematocrit is 60%. Which intervention should the nurse anticipate? Here are the options. Option 1. Administering oxygen therapy. Option 2. Initiating phlebotomy. Option 3. Providing IV fluid bolus. Option 4. Starting anticoagulation therapy. The correct answer is B. Rationale. Correct answer, the second option. Initiating phlebotomy is the standard treatment for polycythemia vera to decrease hematocrit and reduce symptoms. Phlebotomy helps prevent complications like thrombosis by reducing blood viscosity. Distractor rationales. A. The first option, oxygen therapy addresses hypoxia but does not treat the underlying issue of polycythemia. C. The third option, IV fluids can worsen the high blood volume associated with polycythemia vera. D. The fourth option, while anticoagulation may be used, the immediate priority in symptomatic polycythemia is reducing hematocrit. Clinical tip. In polycythemia vera, regular phlebotomy is essential to manage hematocrit levels and prevent thrombotic events. A 3-year-old child is brought to the pediatric clinic by her parents. They report that she has been complaining of pain during urination and frequently wets herself, which is unusual for her. The nurse knows these can be signs of a urinary tract infection, UTI. In discussing health promotion with the parents, which statement by the nurse would be most appropriate to help prevent future UTIs and promote healthy bladder habits? Here are the options. Option 1. Encourage her to drink 1 glass of cranberry juice daily. Option 2. Remind her to wipe from back to front after using the bathroom. Option 3. Limit her fluid intake to avoid frequent trips to the bathroom. Option 4. Teach her to use the bathroom every 2 to 3 hours and after playing. The correct answer is D. Rationale. Correct answer, the fourth option. Teaching the child to use the bathroom every 2 to 3 hours and after playing helps ensure regular emptying of the bladder, which can prevent urine from sitting in the bladder for prolonged periods, a factor that can contribute to UTIs. Encouraging scheduled bathroom visits is a developmentally appropriate strategy for toddlers who may become engrossed in activities and ignore the urge to urinate. This practice supports the development of healthy bladder habits and can help prevent future UTIs. Distractor rationales. A. The first option. While cranberry juice is sometimes recommended, evidence on its effectiveness in preventing UTIs is inconclusive, and fluid variety is more beneficial. B. The second option. Wiping from back to front can introduce bacteria from the anal area to the urethra and should be avoided. Front to back is recommended. C. The third option. Limiting fluid intake is not advisable as it can lead to dehydration and concentrated urine, which may increase UTI risk. Clinical tip. Encourage children to have regular bathroom breaks to promote bladder health and prevent UTIs. Consistent habits can prevent urine retention and bacterial growth. A 32-year-old new mother is admitted to the postpartum unit 2 weeks after delivery. She reports feeling overwhelmed, having difficulty bonding with her baby, and experiencing persistent sadness. Her husband mentions she has been withdrawing from family activities and neglecting self-care. Which nursing intervention should be prioritized to address her psychosocial needs? Here are the options. Option 1. Encourage the mother to join a new mother's support group. Option 2. Assess the mother's risk for self-harm or harm to the baby. Option 3. Provide education on infant care and parenting skills. Option 4. Arrange for a home visit by a community health nurse. The correct answer is B. Rationale. Correct answer, the second option. Assessing the mother's risk for self-harm or harm to the baby is the priority intervention. Given the symptoms of postpartum depression, it is crucial to evaluate the safety of both the mother and the infant. This assessment helps determine the immediate risk and guides further interventions to ensure safety and appropriate mental health support. Distractor rationales. A. The first option. While joining a support group can be beneficial, it is not the immediate priority when there is a potential risk of harm. C. The third option. Education on infant care is important, but does not address the immediate psychosocial concerns related to postpartum depression. D. The fourth option. A home visit can provide support, but it does not address the urgent need to assess for potential harm. Clinical tip. In cases of postpartum depression, always prioritize assessing for safety and risk of harm to ensure both the mother and infant are protected. Early intervention can prevent escalation and facilitate appropriate care. An 80-year-old client with early-stage Alzheimer's disease is living at home with family support. The nurse is conducting a health promotion visit to discuss lifestyle choices that can help maintain cognitive function. Which recommendation should the nurse prioritize? Here are the options. Option 1. Encourage participation in a daily exercise routine. Option 2. Suggest a high-protein diet to support brain health. Option 3. Advise on the use of herbal supplements like ginkgo biloba. Option 4. Recommend engaging in social activities and cognitive exercises. The correct answer is D. Rationale. Correct answer, the fourth option. Engaging in social activities and cognitive exercises is crucial for maintaining cognitive function in clients with Alzheimer's disease. These activities stimulate the brain, potentially slowing cognitive decline. Social interaction and mental challenges can enhance neuroplasticity and improve quality of life. While exercise and diet are important, cognitive engagement directly targets the symptoms of Alzheimer's. Distractor rationales. A. The first option. While exercise is beneficial for overall health, it does not directly target cognitive function as effectively as mental and social activities. B. The second option. A high-protein diet is not specifically linked to cognitive maintenance in Alzheimer's disease and may not address the primary needs of cognitive stimulation. C. The third option. Herbal supplements like ginkgo biloba have not been conclusively proven to benefit cognitive function in Alzheimer's disease and could interact with other medications. Clinical tip. Encourage clients with Alzheimer's to participate in activities that challenge their brain, such as puzzles, reading, or learning new skills to help maintain cognitive function. A 68-year-old male with a history of type 2 diabetes is admitted to the hospital with hyperosmolar hyperglycemic state, HHS. He is confused, agitated, and repeatedly attempts to remove his IV lines. His daughter, who is his primary caregiver, appears overwhelmed and tearful. What is the nurse's priority psychosocial intervention in this situation? Here are the options. Option 1. Provide the daughter with educational materials about HHS. Option 2. Reassure the daughter and offer support resources. Option 3. Administer a sedative to the patient as prescribed. Option 4. Encourage the daughter to take a break and rest. The correct answer is B. Rationale. Correct answer, the second option. Reassuring the daughter and offering support resources is the priority psychosocial intervention. The daughter's emotional state indicates she is overwhelmed, which can impact her ability to effectively support her father. Providing reassurance and connecting her with support resources can help alleviate her distress and improve her coping ability. This intervention addresses the immediate psychosocial needs of the family, which is crucial in managing the overall care of the patient. Distractor rationales. A. The first option. While educational materials are important, they do not address the immediate emotional needs of the daughter. C. The third option. Administering a sedative addresses the patient's agitation but does not directly support the daughter's psychosocial needs. D. The fourth option. Encouraging the daughter to rest is helpful, but without addressing her emotional state, it may not be effective. Clinical tip. In acute care settings, addressing the emotional and psychosocial needs of family members can significantly impact patient outcomes and family dynamics. Always assess and support caregivers' emotional health. A 78-year-old female resident in a long-term care facility has been diagnosed with a urinary tract infection, UTI. She is experiencing confusion and has a history of falls. Which nursing intervention is the most important to implement to ensure her safety? Here are the options. Option 1. Encourage increased fluid intake to flush out bacteria. Option 2. Place a fall risk sign above her bed and ensure the call light is within reach. Option 3. Administer prescribed antibiotics and monitor for side effects. Option 4. Educate the resident about UTI prevention strategies. The correct answer is B. Rationale. Correct answer, the second option. Placing a fall risk sign above her bed and ensuring the call light is within reach is the most important intervention to ensure safety. The resident's confusion and history of falls increase her risk of injury. By clearly identifying her as a fall risk and making sure she can easily call for assistance, the nurse prioritizes her immediate safety needs. This intervention directly addresses the risk of falls, which is a critical safety concern in this scenario. Distractor rationales. A. The first option. While increasing fluid intake is important for treating UTIs, it does not directly address the immediate safety risk posed by her confusion and fall history. C. The third option. Administering antibiotics is necessary for treating the infection, but does not immediately address the safety concerns related to her confusion and fall risk. D. The fourth option. Educating the resident about UTI prevention is beneficial, but does not address her current safety needs related to confusion and fall risk. Clinical tip. In long-term care settings, Always prioritize interventions that address immediate safety risks, such as fall prevention, especially in residents with cognitive impairments. A 45-year-old client with a history of epilepsy is admitted to the emergency department in status epilepticus. The client is unresponsive and experiencing continuous tonic-clonic seizures. Vital signs are BP 140/90 mmGh, HR 110 BPM, RR 20 breaths per minute, SpO2 88% on room air. Which nursing intervention should be prioritized to ensure the client's safety and physiological integrity? Here are the options. Option 1. Administer lorazepam intravenously as prescribed. Option 2. Place the client in a supine position. Option 3. Insert an oral airway to prevent tongue biting. Option 4. Apply soft restraints to prevent injury. The correct answer is A. Rationale. Correct answer, the first option. Administering lorazepam intravenously is the priority intervention for a client in status epilepticus. Lorazepam is a benzodiazepine that acts quickly to stop seizures and is essential in preventing further neurological damage. Ensuring the client receives this medication promptly is critical to restoring physiological stability and preventing complications. While other interventions may be necessary, stopping the seizure activity is the immediate priority. Distractor rationales. B. The second option, placing the client in a supine position, is incorrect as it may increase the risk of aspiration. The client should be positioned on their side to maintain airway patency. C. The third option. Inserting an oral airway during active seizures is contraindicated due to the risk of injury. The priority is to stop the seizure with medication. D. The fourth option. Applying soft restraints is not appropriate as it does not address the immediate need to stop the seizure and could cause harm. Clinical tip. In status epilepticus, rapid administration of benzodiazepines is crucial to halt seizure activity and prevent long-term neurological damage. Always ensure airway patency and monitor vital signs closely. A worried parent rushes their teenager into the clinic after noticing sudden mood swings and a withdrawal from friends and family. The teenager has also lost interest in previously enjoyed activities and is experiencing difficulty concentrating. What should the nurse assess for initially? Here are the options. Option 1. Signs of substance abuse. Option 2. Symptoms of depression. Option 3. Possible bullying at school. Option 4. Sleep pattern disturbances. The correct answer is B. Rationale. Correct answer, the second option, symptoms of depression. The symptoms described align closely with those of adolescent depression, which can include mood swings, withdrawal, loss of interest in activities, and concentration difficulties. Distractor rationales. A. The first option, while substance abuse can cause mood changes, the combination of symptoms more specifically suggests depression. C. The third option, bullying may be a contributing factor, but the symptoms are directly indicative of depression. D. The fourth option, sleep disturbances might be present but are not the primary focus for initial assessment given the presented symptoms. Clinical tip. Changes in mood, social withdrawal, and loss of interest in activities are key indicators of depression in adolescence and should be promptly evaluated. Memory aid. Think of SAD for depression. Social withdrawal, anhedonia, difficulty concentrating. A 14-year-old male is diagnosed with hyperaldosteronism and is admitted to the hospital for evaluation. His parents express concern about his growth and development, noting he seems shorter than his peers. What is the most appropriate nursing intervention for addressing his growth concerns? Here are the options. Option 1. Encourage increased consumption of protein-rich foods. Option 2. Educate the family on the potential impacts of hyperaldosteronism on growth. Option 3. Suggest the use of human growth hormone. Option 4. Advise on physical exercises to stimulate bone growth. The correct answer is B. Rationale. Correct answer, the second option. Education is crucial to help the family understand how hyperaldosteronism can affect growth. This condition can lead to imbalances in electrolytes, which may impact growth and development. By providing clear information on how the condition and its management may affect growth, families can make informed decisions about care and seek appropriate specialist consultations when necessary. Distractor rationales. A. The first option. While protein is important for growth, it may not specifically address the growth issues related to hyperaldosteronism. C. The third option. Human growth hormone should only be considered after consultation with an endocrinologist and is not the first-line intervention. D. The fourth option. Exercise can aid in growth, but it doesn't address the hormonal imbalances affecting growth in hyperaldosteronism. Clinical tip: when dealing with chronic conditions in pediatric patients, providing comprehensive education to the family about the condition's impact on growth and development is essential for managing expectations and planning long-term care. A 40-year-old woman with newly diagnosed multiple sclerosis is being educated on self-management strategies. Which of the following should be included in the teaching plan? Select all that apply. Here are the options. Option 1. Engage in regular low-impact exercise. Option 2. Increase exposure to direct sunlight. Option 3. Follow a high-fat diet. Option 4. Practice stress-reducing techniques. Rationale. Correct answers. The first option. Engaging in regular low-impact exercise can improve muscle strength and overall health. The fourth option. Stress-reducing techniques such as yoga or meditation can help manage symptoms and improve quality of life. E. Avoiding excessive heat exposure is important as it can exacerbate symptoms of multiple sclerosis. Distractor rationales. B. The second option. Increased sunlight exposure can lead to overheating, which may worsen symptoms. C. The third option. A high-fat diet is not recommended and does not aid in symptom management. Clinical tip: educate multiple sclerosis patients on the benefits of regular exercise and stress management, as well as the importance of temperature regulation to prevent symptom exacerbation. A 35-year-old woman with a history of uterine fibroids is attending a health promotion seminar. She expresses concerns about the impact of her fibroids on her reproductive health and potential future pregnancies. Which health promotion strategy should the nurse prioritize to address her concerns? Here are the options. Option 1. Encourage regular pelvic exams and ultrasounds to monitor fibroid growth. Option 2. Advise immediate surgical intervention to remove fibroids. Option 3. Suggest lifestyle modifications such as a high-calcium diet to prevent fibroid growth. Option 4. Recommend hormonal therapy to shrink fibroids before considering pregnancy. The correct answer is A. Rationale. Correct answer, the first option. Regular pelvic exams and ultrasounds are essential for monitoring the growth and development of uterine fibroids, especially in women concerned about reproductive health. This approach allows for timely intervention if fibroids increase in size or cause symptoms that could affect pregnancy. Monitoring helps in making informed decisions about future pregnancies and managing fibroid-related symptoms effectively. Distractor rationales. B. The second option. Immediate surgical intervention is not always necessary and should be based on symptom severity and impact on quality of life. C. The third option. While diet can support overall health, there is limited evidence that a high-calcium diet directly prevents fibroid growth. D. The fourth option. Hormonal therapy may be considered, but it is not the first-line strategy for all patients and should be tailored to individual needs. Clinical tip: encourage women with uterine fibroids to maintain regular follow-ups with their healthcare provider to monitor fibroid size and symptoms, which can help in planning for future pregnancies. The 6-month-old infant diagnosed with failure to thrive is admitted to the pediatric unit. The nurse notes the infant's weight is below the 5th percentile for age, and the infant has a history of frequent hospitalizations. Which nursing intervention is the priority to ensure the infant's safety? Here are the options. Option 1. Encourage frequent family visits to promote bonding. Option 2. Implement strict hand hygiene protocols before handling the infant. Option 3. Monitor the infant's feeding closely to prevent aspiration. Option 4. Provide the infant with a quiet environment to promote rest. The correct answer is C. Rationale. Correct answer, the third option. Monitoring the infant's feeding closely is crucial to prevent aspiration, a common risk in infants with failure to thrive due to potential swallowing difficulties. Ensuring safe feeding practices is a priority to prevent respiratory complications and ensure adequate nutrition. This intervention directly addresses the safety and nutritional needs of the infant, which are critical in managing failure to thrive. Distractor rationales. A. The first option. While family bonding is important, it does not directly address the immediate safety concerns related to feeding and aspiration risk. B. The second option. Hand hygiene is essential for infection control, but does not specifically address the safety concern of aspiration during feeding. D. The fourth option. A quiet environment can be beneficial for rest, but does not address the immediate safety risk of aspiration during feeding. Clinical tip: when caring for infants with failure to thrive, always prioritize interventions that address immediate safety risks, such as aspiration during feeding. A 68-year-old client with viral pneumonia is admitted to the hospital. The client is on supplemental oxygen via nasal cannula at 2 liters per minute and has a history of COPD. The nurse notices the client is confused and attempting to remove the oxygen tubing. What is the nurse's priority action to ensure the client's safety? Here are the options. Option 1. Apply soft wrist restraints to prevent removal of oxygen. Option 2. Increase the oxygen flow rate to 4 liters per minute to improve oxygenation. Option 3. Reorient the client and ensure the oxygen tubing is secure. Option 4. Notify the healthcare provider about the client's confusion. The correct answer is C. Rationale. Correct answer, the third option. Reorienting the client and ensuring the oxygen tubing is secure addresses the immediate safety concern of the client removing the oxygen, which could compromise their respiratory status. Confusion in clients with COPD and pneumonia can be due to hypoxia, and securing the oxygen source is crucial. This action also respects the client's rights and avoids unnecessary restraint use. It is a priority to address the potential cause of confusion by ensuring adequate oxygenation. Distractor rationales. A. The first option. Applying restraints should be a last resort and only used when all other measures have failed, as it can increase agitation and is not the first-line safety intervention. B. The second option. Increasing the oxygen flow rate without a provider's order can be dangerous, especially in clients with COPD, due to the risk of suppressing their respiratory drive. D. The fourth option. Notifying the healthcare provider is important but not the immediate priority action to ensure safety and proper oxygenation. Clinical tip: in clients with respiratory conditions, always assess for changes in mental status as they can indicate hypoxia. Ensure oxygen delivery systems are secure and functioning properly to prevent complications. A 65-year-old male client with a history of Paget's disease presents to the clinic for a routine checkup. He reports mild bone pain and has been experiencing increased fatigue. His current medications include bisphosphonates. As part of health promotion and maintenance, which lifestyle modification should the nurse prioritize to support bone health and prevent complications associated with Paget's disease? Here are the options. Option 1. Increase dietary calcium and vitamin D intake. Option 2. Engage in high-impact exercises like running. Option 3. Limit sun exposure to prevent skin damage. Option 4. Adopt a low-protein diet to reduce bone turnover. The correct answer is A. Rationale. Correct answer, the first option. Increasing dietary calcium and vitamin D intake is crucial for clients with Paget's disease to support bone health and prevent complications such as fractures. Calcium and vitamin D are essential for bone mineralization and strength, which can be compromised in Paget's disease due to abnormal bone remodeling. Ensuring adequate intake helps maintain bone density and reduces the risk of fractures. This recommendation aligns with evidence-based guidelines for managing bone health in individuals with Paget's disease. Distractor rationales. B. The second option. High-impact exercises like running can increase the risk of fractures in individuals with Paget's disease due to weakened bones. C. The third option. While sun protection is important, moderate sun exposure is beneficial for vitamin D synthesis, which is crucial for bone health. D. The fourth option. A low-protein diet is not recommended as it does not specifically address bone health and may lead to nutritional deficiencies. Clinical tip: encourage clients with Paget's disease to consume foods rich in calcium and vitamin D, such as dairy products and fortified cereals, and to engage in weight-bearing exercises to strengthen bones.
Your score and detailed rationales will follow in tutor mode. Discover Exam ASAP, our advanced AI-powered platform with over 5,000 peer-reviewed NCLEX-style questions. With adaptive testing, audio rationales, daily updates, and 24/7 tutor support, it's designed to help you pass the NCLEX on your first try. Visit yournursingspace.com for our ultimate NCLEX mastery notes and free study guides. Like, subscribe, and check out our website for more content. Keep up the great work, and we'll see you next time.